I am Tommy Pastor. I'm the director of the Genomic Medicine Center at Children's Mercy, Kansas City. At Children's Mercy, Kansas City, we sequence children with rare disease and try to find answers, especially in cases where clinical sequencing has already been conducted and didn't resolve the case. We pursue long-read sequencing for such cases. At Children's Mercy, we initially, for the last 5 years, used PacBio sequencing in the research space. For the last year, we've actually moved it into a clinical service as well and provide it to critically ill newborns and children that are admitted to our hospital as a first-line genomic test. So 5 years ago, when a Sequel 2E was released and the throughput of PacBio sequencing increased substantially, it became a possibility to sequence a whole genome rather than 90% of the genome as we were doing with short-read sequencing. And we felt that the diagnostic rate for rare disease was partially low because we were not sequencing the whole genome and not all the types of variation that was in the genome. And with PacBio, we could initially resolve structural variants better, later on methylation, and now even personal assemblies, allowing us to see the full genome of each child we sequence. The Revio technology we adopted at the first release. We purchased 2 Revio systems. Currently we have 5 Revio systems. 4 of them are dedicated to clinical sequencing and 1 is for research today. Within our rare disease research program, even after PacBio sequencing, we have a number of kids that are unsolved. And one of the reasons is that there's a genetic variant that changes RNA structure in a way that is difficult to predict. So we actually need to go and sequence the patient's RNA. In the past, we used PacBio's IsoSeq for full-length long-read RNA sequencing. Now that Kinnex is coming available with much higher throughput, we're actually trying to integrate Kinnex into as a second-line test for a negative long-read genome in a rare disease case. In the past, the throughput of full-length RNA sequencing was low enough that it added substantial cost to genetic testing, and we were very selective on how we deployed it in patients. Now with much higher read coverage and throughput and ability to multiplex on a Revio, we can actually do this in a cost-efficient manner and introduce it to many more patients that we were not able to cater this before. In our rare disease sequencing program, as soon as the methylation detection came available about 2 years ago for our PacBio sequencing, we started to test it for negative genomes, trying to find methylation variation that was very unusual and could pinpoint towards a disease gene. And we actually did find a few cases true methylome variation that were unsolved before just by looking at nucleotide variation. We are integrating the methylation detection to our standard clinical testing. There's about 12 rare diseases that are caused by methylation defects. Those are detected concurrently with the sequencing, but beyond that, we are using it as a R&D tool to find new types of variation and are developing pipelines to identify very rare methylation patterns in unsolved disease of children. Long-read RNA sequencing is the next kind of a natural next step in understanding particularly the rare disease area that we work on, and extending to the still about half of the patients remain undiagnosed after even backbias DNA sequencing. We do believe that around 15 to 20% of those unsolved cases can actually be solved by sequencing RNA. The challenge there is to the source of RNA. So in most cases, we are restricted to getting a peripheral blood transcriptome. It may not be sufficient for all cases. So we are constantly working towards better tissue models for disease, and then coupling long-read RNA sequencing to these patient-derived tissue models to understand RNA better in rare disease. It's an up-and-coming feature in disease genomics, and it's going to be increasingly utilized as we go along. So at Children's Mercy, we launched clinical hi-fi genome sequencing almost exactly a year ago, and started to offer it to critically ill newborns and children that are admitted to our hospital. So the most severely affected children were offered hi-fi genome sequencing, and the results have been really promising. The diagnostic rate is over 10% point higher than it was with earlier genomic tests. The number of genomic tests is reduced because in the past, kids received multiple sequential tests, sequencing, karyotyping, microarray testing. It's all now bundled into one hi-fi genome sequencing test. So it is changing the standard of care for these critically ill newborns and children. We'd hope to be able to offer it to outpatients, which are much larger pool of rare genetic disease. But at present, the throughput and cost are still forcing us to offer it to the most critically ill patients. The greatest insight we are experiencing from backbio sequencing in the pediatric rare disease setting is there is actually more patients with repeat expansion disorders, complex chromosomal aberrations, complex structural variants that previously took years to solve, and now we can get the answer in 2 to 3 weeks from a single test. I think the landscape of what type of genetic lesions underlie rare disease in children is changing because we are implementing a comprehensive test for all children in the beginning of their diagnostic odyssey. At Children's Mercy, we offer hi-fi genome sequencing for the critically ill newborns and children, which actually include a number of infant hypotonia, loss of muscle tone early in life. And the reasons underlying infant hypotonia are often such that you can't detect those only by short-read sequencing. You actually, in the past, did panel testing for some repeat disorders, plus exome sequencing, plus microarray testing, and now it's all bundled into a single test. So definitely infant hypotonia is one of the indications. Other indications are movement disorders that are relatively common in childhood. So ataxias, different forms of dystonias. Again, the type of genetic variation that underlies these diseases has been somewhat difficult for short-read genome sequencing, and is part of the routine pipeline by long-read hi-fi genome. So Children's Mercy has worked with BacBio closely for the last 5 years. We actually initiated our rare disease sequencing program in collaboration with BacBio. Since then, we've just been a close customer and early adopter of many of the new technologies that are offered with BacBio. We're excited to work with BacBio. The support has been tremendous. I think the developments over the years, especially in the side of analytical tools for bioinformatically handle the data, has been really fast and has enabled us to do things on the clinical side of sequencing that we couldn't imagine 3 years ago. So we're very happy to closely collaborate with BackBio to develop better tools to help children.